There's no denying that we live in a screen-saturated world. From computers to mobile phones to tablets, we spend hours each day looking at screens. However, intense screen use can have an impact on our eye health and may actually also trigger symptoms of chronic dry eye. So ophthalmologist Dr. Priya Gupta and someone who's no stranger to screens, YouTube personality and gamer Atomic Mari, are here to talk about the effects that it has on us. Ladies, thank you so much for being with us.
Thank you.
Yeah, thanks for having us.
Well, Mari, I said you're no stranger to screens, but kind of give me like a day in the life of you and your screen use.
Sure. So I play video games for a living, which admittedly is not a very orthodox career, but I think my screening habits are actually pretty normal for all of us. Actually, you know, I wake up and I look at my screen. I look at social media. I check out my emails. I go to work, and I'm in front of screens all day. And I probably binge watch shows when I get home. So you know, it was important for me to be paired up with this initiative because screens are really a normal way of life now, and the way that technology is moving, I don't think it's going anywhere. And so it's important for all of us to figure out what our screening habits are and to figure out how we can do better for our eye health.
And you were right. I think your screen use isn't probably very far off from a lot of regular people. Did you start noticing it having an effect on your eyes?
Yeah, you know, I mean, my symptoms are probably going to be different from somebody else's, which is why it's really important that, you know, if you ever find any sort of difference in your eye health or, you know, any red flags come up, to seek out help and to talk to your eye care professional.
And I know there was a survey talking about how, you know, a lot of people can have different things. What were some of the revelations that came out of this survey?
You know, it's one that stuck out to me is that adults don't want to talk about it. 64% of adults are actually guilty about the amount of time they're spending on screens and having to have to admit it. In fact, 55% of adults would much rather talk about how much alcohol they had over the weekend versus talking about how much they are looking at screens. I don't think it's any, you know, we all do it, and I think it's just about talking about it and being okay with it and just finding out those little tips and tricks to screen better and to screen more responsibly.
Screen more responsibly. And you're like, most of us, all of us, or a lot of us do that. So doctor, that goes back to what I said at the very beginning about this maybe triggering the chronic dry eye. What really is dry eye? Can you kind of explain to everybody?
Absolutely. Well, dry eye is a disease that affects 30 million Americans, if not more. And it's really characterized by feeling like your eyes are red, irritated, gritty. You might have eye strain, eye fatigue. And if it's really bad, your vision might even get blurry, making it hard for you to do the things you want to do.
Now, are you kind of seeing a correlation, since, of course, you know, you have patients with it, between screen time and the dry eye?
Absolutely. I mean, this is something that I see regularly in my clinic. As part of the Screen Responsibly initiative, this national survey that was done, they talked to 1,000 eye care providers. So these are ophthalmologists and optometrists. And 3 out of 4 of the eye care providers reported that they're diagnosing dry eye much more commonly today. But more importantly, they're diagnosing it in younger patients. And so the vast majority of them felt like this was related to increased screen time.
Well, let's make sure that our viewers are doing something to combat that. Can you give us maybe something we can do now to do screen time more responsibly?
Absolutely. We don't want anyone to give up their screens. That's not realistic. But one of my favorite tips is the 20-20-20 rule. So what this is that for every 20 minutes of screen time, and you know, some people stay on the screen for hours at a time. So after 20 minutes, we want you to take a 20-second break, not too long. And then we want you to look 20 feet off in the distance. And the reason why we think this works is that what happens is when you're staring at your screen, you don't actually blink normally. So if you don't blink normally, what happens is that the tear film doesn't spread across the eye, so it's not protecting your eye properly. By taking just that 20-second break and looking off in the distance, you're actually restoring that normal blink. So the tears spread better, and then your surface is protected.
Well, that's easy. We can all start doing that right away. Doctor, where can I go online to get more information on dry eye or the survey or anything we've talked about?
Absolutely. We'd love everybody to go to screenresponsibly.com.
Well, Dr. Mari, both of you, thank you so much for talking about this. It's definitely something that affects a lot of people.
Absolutely. Thanks for having us.
We'll be right back.